Welcome back to the Collender Medical Radio Show. I'm your host, Anne-Marie Cronin, here talking with Dr. Brian Collender, board certified in internal medicine and specialist in artery disease with offices in Bingham Farms and downtown Detroit. Dr. Collender is here with us discussing his concierge practice and how to avoid heart attack and stroke and how to begin the reversal of artery disease. Now, Dr. Collender, during the last segment, we were discussing the importance of cholesterol, HDL and LDL, and then you brought up this other test that is more of an indicator about heart disease, which is the ApoB test. You also mentioned that a lot of doctors don't perform this test as a standard test. And my question to you is, with all the people dying out there of heart attacks, why is it not involved, and why are you doing it?
Well, Amory, those are questions I wish anyone had the answers to, because you said it yourself. It's a standard test. It's an ApoB and some of these other lab tests I want to talk about in the next segment they're not standard, and doctors don't have time to do anything that isn't cookie cutter. Order this test, hit the button, I'm done. They do the same thing for everybody. People need to have personalized care. Everybody's different. The way the tests I'm discussing are interpreted need to be put in a personalized context for each individual person. And it may involve a conversation about how are you living your life, so that I can tie it into your lipid panel. That is a lot more complicated than the standard lipid panel. I should say not more complicated, but more useful, because we've already discussed how the standard lipid panel is pretty much useless. So ApoB is a protein that's attached to every bad cholesterol. So when I want to say bad cholesterol, there's only one good cholesterol that we said, and I'm still quotation marks good, is your HDL. All the other lipid particles have ApoB on them, and those ApoB proteins are what gets caught up in the lining of your artery and makes them inflamed and begins the process of plaque development. So LDLs that are not inflamed until they get into the artery doesn't gauge risk, because every other particle is inflammatory earlier in the process. So we need to know about all those particles and have a gauge for them, and your ApoB marker is a gauge of all your bad particles. And some of them respond to medicines or one or the other type of medicines, and most of them require nutrition to manage. And sometimes we need to do other inflammation markers to identify who needs a medication, who needs lifestyle approach. So this is very complex and detailed, but on a personal level. You need someone like me who spends time with patients to sort out who needs what. So the goal of being heart attack and stroke proof is not straight, and each route is different for every person, and we need to be able to run through this complex maze that everyone has to get to their personal goal of long-term health. So, doctors don't have time for this. They do the standard thing for everybody. If you're not working with a personalized healthcare doctor, you're getting a standard protocol that doesn't work for most people.
Okay, so here's my question. You go in to see your primary care physician, and this ApoB is discovered in a blood test, in a blood draw, right?
Right.
That's where you find the number. You find what the concentration is, right?
Right.
So how many vials of blood do you take in a standard blood test?
Oh, who knows? I don't know the answer. Ask my MAs may know. I don't know that it matters to vials. It just depends on what blood test.
I guess the point that I'm asking is, if you're going to be withdrawing blood anyway, wouldn't it make sense to just go ahead and have this include this test?
You're asking a question that's more systemic of the whole system. It's an indictment of the system,
right,
not an individual doctor. The doctor's doing what they got to do to make a living and see patients. It's too hard to fight the system when you're seeing 30 to 40 people a day. When you take yourself out of the system a little bit to allow time to see people and do this, you can do it. The system doesn't allow it. It's not these doctors' fault that they're not doing these tests. It's your doctor's fault that they're not leaving the system, becoming an MDVIP doctor, for instance, so that they can practice better care for you, the listener. And it's up to the listener, you, to take responsibility for your health and say, you know what, my doctor's not spending the time that I need. I got to go find someone that will. Or tell your doctor, if you love your doctor, go, hey, you need to be an MDVIP doctor because I want to keep you and I want you to do a better job for me. So all of these possibilities exist. It's up to the patient to demand it. It's up to the doctor to demand it of themselves, that they become better and put themselves in an opportunity to do a better job. It's not out of reach. That's what's not happening. No one's going to fix the system. It's not going to be undone. It's too powerful. So to ask an individual doctor, why aren't you ordering ApoB? It's an uphill battle for them. They can't do it. You can't fight City Hall on every patient when you're seeing 40 people a day.
No, I agree with you, but I think that with the fear of stroke, heart attack, cardiac incident, whatever, if I know that there's a blood test out there that I can get that's going to help you in any way as an MD to see where I'm at, what my profile is, where we're going with this, I mean, and I understand this comes under your concierge practice because you have time to spend.
It's not just a time. You make it sound like there's one test, and there isn't. It's complicated. There's multiple inflammatory markers that we need to look at. There's multiple different lipid particles that we look at to gauge risk. There's visual testing that we look at. For instance, I like to have all my patients get a coronary artery calcium score. And the reason is, it's a test that identifies whether that person is making hard plaque. Because treating cholesterol in a vacuum is not good. That's what the system's doing. Right. They're taking cholesterol and your 5-6 variables, plugging into a formula in a vacuum. We've got to individualize it and take this out of a vacuum. I'm not treating cholesterol in a vacuum. I want to know, do you make plaque? Do you make hard plaque? I get a calcium score for that, which is low cost, done at most hospitals in 15 minutes. And then I want to know, do you make soft plaque? Soft plaque is the kind of plaque that gets dangerous because that's the one that ruptures and causes a sudden event like a heart attack or stroke and kills people. So the way we identify a soft plaque is to do an ultrasound of the wall of your arteries. That's done in my office. It's not done at any hospital or anywhere else, and the reason is it's not covered by insurance. Michigan in particular is a bad place to have preventative services done. So,
well, very few people are doing the test you're talking about.
Very few. So again, I want to invite the listening audience because I realize you're going to go out there and go, you just told me the most important test I need to get is this carotid intima media thickness test or CIMT test, and I can't get it. Well, I want to make everyone clear that they can call my office, 248-737-0091, and I will make sure you get a CIMT and you have an opportunity to go over the results with me and kind of get the ball rolling for you. So don't feel like you can't do this, it's out of touch. I'll get that for you. I don't want to give you this information, then you can't get it.
Now I know that you're also saying that all of your patients should have the CT scan, the cardiac calcium scoring. That is easily attainable at most hospitals. It's not covered by insurance, but it's very inexpensive. I think it's around about $100 to have the test
or
done.
$125.
Or $125. And they just need to get a prescription to get it. So
Correct.
they have to call either their own doctor or to get in touch with you to get the CT scan. So at least that's a starting point. And then, you follow up obviously with the other tests. So, well, we're going to have to take a quick break. And in the meantime, you're listening to the Collender Medical Radio Show. You can reach Dr. Brian Collender by calling 248-737-0091. Again, that number is 248-737-0091. You're listening to the Collender Medical Radio Show on News Talk 760 WJR.